Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again for a radio audience tuning in at WYAD 94.1 FM and WYADonline.com. We're glad that you all can be with us. Also tuning in worldwide via our podcast at iHeartRadio and Amazon Music. We're glad you all could be with us as well. This is part of a Music and Youth segment here at WYAD, and today we're talking about developing the next generation of public health workers. A recent study found that nearly half of public health workers left their jobs, get this, between 2017 and 2021, which means that state and local health departments nationally need to hire about 80,000 people to adequately provide public health services. Well, the Public Health AmericCorps and a partnership between AmeriCorps and the Centers for Disease Control and Prevention can help fill this gap and advance more equitable health outcomes for underserved communities. With support from Public Health AmericCorps, Vote People SOS is enhancing healthcare access to Vietnamese Americans and addressing the social determinants of health in communities across the country. Well, here to talk to us more about that, we're excited to welcome Michael D. Smith, who's the Chief Executive Officer of AmeriCorps. And we also have joining us today Jane Nguyen of Vote People SOS, who's going to also talk about the work that they provide as well. Thanks to the two of you for being on with us for this important topic. Really appreciate it.
Thank you so much for having us.
Michael, I'm going to kick things off with you because we've had individuals that have come on before that work with AmeriCorps, and we're familiar with the work that they've been able to do. But what are the challenges currently facing the public health sector?
Look, first of all, thank you for having us again. I think COVID-19 did a few different things. One, it exposed so many challenges that our communities were already facing. It didn't create them, but it shone a spotlight on challenges we were facing, whether that was in our schools, whether that was in our food supply. But it also exacerbated many of those challenges that were out there and made them even worse. And one of those challenges were challenges related to our public health system, whether that was food insecurity or substance abuse or mental health. But not only those challenges that we're facing in public health, but also a massive workforce shortage, as you described, 80,000 missing public health workers that communities so desperately need all across this country.
And I think that's why this conversation is so important. So what public health needs does Public Health AmericCorps address? And it's interesting, I think when we talk about AmeriCorps, we don't think about there being different divisions there, Michael, but talk to us about Public Health AmericCorps and exactly what it's doing to help.
Well, one of the things I am so proud of is AmeriCorps is about the local needs of the community. So there are AmeriCorps members working on everything from education to public safety to climate to health, and it's been a part of the work we've been doing since we were founded 30 years ago. Public Health AmericCorps is doing a couple different things. One, we're just proud to partner as the Federal Agency for National Service with our colleagues at CDC. And so first, AmeriCorps provides people power. We bring in passionate, compassionate, driven individuals who want to provide sustained service to their communities, and they're going to be working on urgent public health needs right now. But the other thing that we're doing, which I think is the secret sauce here, is we're providing the training, the credentialing, the certification, and the coaching so that folks that are serving in Public Health AmericCorps actually end up staying in public health fields and staying in the communities where they're serving. But I think to really understand what that work looks like in practice, there's no better spokesperson than Jane Nguyen to talk about what that looks like with Vote People.
And Jane, I'm so glad you could be with us as well to talk to us more about Vote People SOS. So can you tell us more about the organization and how Public Health AmericCorps supports the work that you do?
Yes, so Vote People SOS is a Vietnamese-centered nonprofit organization. We were formed in the 1980s to conduct joint rescue at sea missions during the height of the Vietnam War. We rescued Vietnamese boat people from the South China Sea. We are currently in our 44th year of service and now have offices across the United States as well as an international office in Thailand. Our work with AmeriCorps has been so profound, just the whole collaboration. They have provided critical support to our organization by giving us the capability to build our capacity. As well as building our capacity, the partnership has also helped us to facilitate the recruitment of college-age youth. A lot of our work is centered with the older generation, limited English proficiency, Vietnamese community. And now that we're able to bring in youth and provide them with valuable insights into our organization as well as public health work, we've really engaged them in our mission-driven work to provide public health to a community where it's needed in these underserved and marginalized communities.
Yeah. Jane, I want to stay with you for a second. Can you tell us what it's been like for you to see not only the difference that Boat People SOS has been able to make, but also the impact you've been able to make as well?
Yes, I can speak for within the state of Mississippi, along the Gulf Coast of Alabama, there's very limited medical providers that speak the language, the Vietnamese language. There's very few culturally competent health materials and resources that are provided to the community here. Along the Gulf Coast, our office is based in Biloxi, Mississippi, where we have an estimated around 13,000 to 14,000 population for a Vietnamese community, and we do not have not one medical doctor that speaks the language. So wow. Our public health AmericCorps, it has been a profound impact. They've been assisting us with developing culturally competent health materials, creating translated materials, providing interpretation services at medical doctors' offices, health navigation, assisting community members with navigating the healthcare system, which I think everyone knows is a very complex system. It just, naturally, English-speaking community members, it's very hard for them to access it. So thinking on the spectrum of a whole community population of people that do not speak the language, that's needing to access the healthcare system, and the difficulty that comes for them. So this work has been very profound in our community.
Well, Jane, I'm so glad that we could help to shine a spotlight on the work that Boat People SOS is doing. And, Michael, so glad that you can tell us about what's happening there with AmeriCorps and how they are able to help thanks to the partnership with the CDC. Michael, let our audience know, where can they go to find out more information about AmeriCorps and the work that they're doing there?
Well, we've got opportunities that are available today. So if you want to serve, you don't have to wait. You just go to AmeriCorps.gov/public health. And we will find an opportunity for you in Mississippi, in Alabama, in Arkansas, in Georgia, or all across this country. AmeriCorps.gov/public health.
All right, appreciate that. And Jane, what about you? How can our audience find out more information about the work that Boat People SOS is doing?
Yeah, they can visit our website at www.bpsos.org. We have branches across the nation, not just in Mississippi and Alabama. They can reach us there, and there's a little chat box. They can go in and chat, or they can give us a call at any of our local offices.
Love that. Well, thanks again for the two of you for spending some time with us today. Really appreciate it, and looking forward to speaking with you again.
Thanks, Cyrus.
Thank you.
Glad to have you. And we thank your audience for tuning in to another great segment of Conversations Live, again, part of our Music and Youth segment here at WYAD. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Let us go make today amazing. Take care.